Okay, so I'm Samir Lirarachi. I'm discussing you regarding substance abuse, heroin addiction. So we'll see what is heroin addiction. So first, you want to know what is substance use, abuse, and dependence. So substance use just having illicit drugs, and substance abuse means they are repetitively taking illicit drugs uh, and without knowing exactly causes issues in their life. Then substance dependence called a full-blown addiction. So in this stage, they will get some bad side effects to the body if they are not having these drugs. So therefore, what they are doing is they have to take these drugs to prevent those side effects that they will get. This stage called substance dependence. Then commonly used substances, alcohol, tobacco, marijuana, hashish, heroin, opium, cocaine, amphetamines, methamphetamines, and LSD. So what is heroin? So exactly it is extracted from a plant called Papua somnifera. So heroin, it's the same thing that we use as a treatment called morphine. So heroin is called scientifically dimorphine, and morphine is a good substance to treat for the pain in the patients, but heroin is an illegal and extremely addictive substance. It is derived from opium or poppy plant, as I mentioned earlier. So it can be taken by smoking or snorted or injected by them. Uh, why do people use heroin? What's the reason? So heroin is abused for the immediate pleasurable feelings. So they will feel some pleasurable feelings, especially a thing called euphoria, an elated mood they will get, and effects of heroin abuse. Here, tolerance is indicated by need for more of the substance, higher purity, or different methods of delivery to feel the same results. Then, dependence, I mentioned earlier, is when your body requires heroin to feel normal and withdrawal symptoms present without substance in your body. Then, effects were the risk of infectious disease, including HIV/AIDS and hepatitis, are common because they are sharing needles to inject heroin, so therefore they can easily get these diseases. And persistent mental health issues such as depression, personality changes can cause these people. And also reproductive issues like sexual dysfunction and incontinent menstrual cycle. So they will develop sexual dysfunction, therefore it's a big effect for the generation of the population, and damage to the tissues of nose from snorting. And women that use the drug while pregnant are at risk of miscarriages and low birth weight. Here you can see long-term effects of heroin, central nervous system, addiction, tolerance, dependence, three things by the brain. Circulatory system collapse, veins will be collapsed. Then heart infections are common. Respiratory also infection, pneumonia can be seen in commonly. Then liver function will be reduced, and abscess can be formed systemically. Then effects of heroin abuse, risk of overdose. We will see what can happen with overdose. Dangerously decreased respiratory rate. Uh, Sometimes people are having some medications related to cough suppressions that containing codeine and some other substances. They are also in the same group of heroin. So if they have much more amount, the cough, not only the cough, but also respiratory rate, respiration will be suppressed. So if they suppress the respiration, they will not get enough oxygen amount and can cause die. And decreased heart rate also can be seen. Then loss of consciousness especially, and brain damage, coma and death can cause. Here, psychological, social and behavioral effects of heroin. Depression and fluctuation of mood, you know that. Then relationship issues, they may get family issues, family problems, overspend for heroin, theft. Then risk behaviors such as driving while intoxicated, unsafe sex, sharing syringes. Then social isolation, other people will isolate him, and then they will not come towards him because of this heroin addiction. Then poor hygiene, they have poor hygiene, also grooming, loss of interest in hobbies and relationship, especially regarding the sexual desire also will be reduced with the sexual dysfunction. Then hostile or aggressive behaviors can be seen, and also poor performance at work, school or home. Then heroin withdrawal symptoms, especially you want to know agitation, widespread pain in bones and muscles, trouble sleeping, that is called insomnia. Then rhinorrhea, they can have some infectious diseases, and also nausea, diarrhea, and vomiting. Increased lacrimation, feeling cold, involuntary kicking movements, strong craving for more of the substance. Here, what is our goal of the treatment? Maintains treatment of opioid dependence to achieve reduction in harm from intravenous drug use and to stabilize the individual's lifestyle. So those are the importance. Then treatment for withdrawal, detoxification from opioids to achieve complete abstinence from opioid substance abuse, and also relapse prevention. Types of treatment, one thing is medical treatment, then psychological and also social. Medical. Opioid substitution therapy. That means we are giving a substitution for opioid. That means for heroin exactly. You know, we give methadone, especially in a psychiatric hospital. They will send you to the psychiatric hospital, and there they will be get treated with methadone therapy. And adjunctive therapy and symptomatic treatments are available. Opioid receptor agonist also there. Example, naloxone. So here, substitution therapy, methadone, a slow-acting opioid agonist, you know. Then buprenorphine is another medication, a partial opioid agonist, but basically we are using the first one, methadone. Adjunctive therapy and symptomatic treatment, you know, headache can be developed, and paracetamol can be used, and sometimes they will develop diarrhea or constipation. For diarrhea, we give loperamide to stop diarrhea, and metoclopramide if they have some vomiting condition, metoclopramide can be given, and benzodiazepines for some aggressive feelings to diminish those aggressive feelings. Then naltrexone blocks the action of opioids, is non-additive or sedating. So even in morphine overdose, we use naloxone or naltrexone to block action of opioids. So this is called opioid receptor antagonist. Then psychologically, one-on-one psychotherapy and group therapy can be used. So especially cognitive behavioral therapy. As you know, to modify the patient's expectations and behavior related to drug use and increase skills in coping with life stresses. So cognition will be improved in this case. So we can give different activities for them and improve their cognitive and behavioral action. Then Contingency management, a voucher-based system in which patients earn points based on negative drug test, which they can exchange for items that encourage healthy living. So, actually, it's not currently happening in Sri Lanka, but basically, cognitive behavioral therapy is a good treatment method we are using. Then, social support should be there for the people and also economical support. So, this is a case that I have given to you to do to prepare a care plan for a patient who has taken heroin. So you read something more related to these areas and try to make more understandable and do these nursing diagnosis and care plans further. So as a summary, we discussed about the substance uses, what are the substances regularly uses, and especially regarding opioids, that means especially heroin, and what are the actions and what are the symptoms and treatment plans and nursing action. So thank you for hearing to the session.